Welcome to the Holistic Plastic Surgery Show, where we dive deep into the hottest trends in health, beauty, and cosmetic treatments. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Plastic surgery is a continually changing field. What is yesterday's great new idea could be today's gold standard, but tomorrow's obsolete treatment. So what's hot today, what plastic surgeons and patients are all excited about, just might not be as great as it seems. So on this episode, I'm joined by a nationally recognized plastic surgeon to discuss some of the hottest topics in plastic surgery. Does the Scarless breast lift actually work? What is the best non-invasive fat reduction technique? How about the internal bra? Is that a good idea? Well, what about the new injectable fillers? Well, we'll cover the hottest topics in plastic surgery today and give you our recommendations about what are currently the most talked about treatments in cosmetic medicine. So let's get started. My guest this week is a board-certified plastic surgeon and chief of plastic surgery for Jackson North Medical Center in Miami, Florida. He is a clinical assistant professor in the Department of Surgery at Nova Southeastern University, clinical faculty for the Department of Plastic Surgery at Florida International University School of Medicine, and clinical faculty for the Cleveland Clinic Plastic Surgery Residency Program in Florida. He is an active member of the American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgery, for which he serves as a board member. He specializes in cosmetic and reconstructive surgery of the face, breast, and body, and gives lectures about his techniques at national meetings. He is also one of the most popular plastic surgeons in the country on Snapchat and Instagram. I'd like to welcome my good friend, board-certified plastic surgeon, Dr. Adam Rubinstein, to the Holistic Plastic Surgery Show. Well, thank you so much for coming on the show. Now, Dr. Rubinstein and I are actually in Las Vegas at Vegas Cosmetic Surgery, and this is one of the top cosmetic plastic surgery dermatology conferences in the country. And so we're literally collaborating with some of the top experts in the field of plastic surgery, facial plastic surgery, dermatology, and oculoplastic surgery. So it's a pleasure to have you on.
It's great to be on the show.
Now, if you're listening to the podcast you hear a little bit of background noise, people coming in and out, it's because we are at this conference, and this is not the typical podcast that we do. But I'm really excited to bring you such an esteemed guest, somebody who really is a leader in the field of plastic surgery, and somebody who is such an advocate for patients and for responsible plastic surgery. So we're going to get into that today.
Well, thanks. You're too kind. I'm just glad to be part of the show and glad to hopefully get some great information out for your followers.
All right. Well, the first thing I'd like to talk about are some of the hot topics that we have in the field of plastic surgery right now. There are a lot of things that we're talking about at this meeting today and really this week that are really exciting developments in plastic surgery. You've given a couple of talks. Can you tell us the talks that you've given and that you are giving at this conference?
Sure. Well, in my practice, one of the things that I do is a lot of customized surgery. I do a lot of breast surgery, as you know, and so when I'm doing breast surgery, I don't like to do what I call surgery by the numbers. That's where you're doing measurements, you're kind of marking things out, and you just cut and go. Mm-hmm. You don't really take enough into account what patients want, what the tissue is like, and so as you're doing the surgery, as you know, there's a lot of things that change, a lot of things you got to take into account, and it doesn't always work out the way the textbook says it should work out, when you do those measurements. So my technique that I presented was something called customized circumvertical Mastopexy augmentation, which is a real fancy way term to say a lift, putting implants in, and doing it customized. So everything that I do is designed in the operating room. I don't really do any markings of incisions or measurements in advance. It's all designed on the table.
So it's kind of like the difference if you go to the store and you pick out a shirt and you put it on, you go, this kind of fits. Or if you go to an actual tailor, somebody who's actually going to create that suit, those clothes that will actually fit your body perfectly. And I was actually at that lecture, found it very interesting. And we do some things similarly, some things not quite the same, but that's okay. One thing I'd like to ask you about that's definitely a hot topic here, especially being such an expert in breast surgery and breast implant surgery, is the advent of the Scarless breast lift. Now, this is something that I've told my patients about for years, that it does not exist. This is the first time that I'm actually hearing and seeing some results that are pretty impressive.
Yeah, I think there's been a lot of advancements, as you know, in radiofrequency technology. And radiofrequency technology is a way of inducing heat into the tissue. You put the energy in, it raises the temperature of the tissue, and that will lead over time to more collagen deposition, tightening the collagen, and that leads to raising up the breast and tightening the breast. When we use it in the breast, we use it in the neck, we use it in the tummy, all over the body. But the Scarless breast lift is really based on using radiofrequency technology in the breast to tighten it and get a more firm, perky breast.
Yeah, so there are two companies that have created devices that have been tested quite a bit, at least the ones that I've seen. Thermi is one of them. The other one is Body Tight. And so the idea behind these procedures, like you said, is that you put this type of a probe, usually with radiofrequency heat, and you heat up that deep skin to try to get it to contract. So have you been impressed with the results that you've seen? What are your thoughts? Is this something that you would recommend to your patients yet?
Yeah, I think you have to continue to look at it, but the early results are pretty impressive in some cases. Now, when you have a new technology, anytime there's new technology, you don't necessarily want to be the first person on the block to run out and get it done. There's kinks to work out. There's refinements of technique. And so we're in the early stages of this procedure, but it is very promising.
Yeah, and I think the big thing, there's two ways I think that we can get rid of scars. We can prevent them with technology like this, which, just like you said, I'm excited about it. I haven't been doing it, and I'm still going to kind of watch it for a while, I think, before I try to incorporate that in my practice. But we can try to prevent scars, or we can try to get rid of scars by treating them. And unfortunately, neither of those we're quite, I think, where we want to be at yet. So another thing that with breast lift surgery that has vexed me and other plastic surgeons really for decades is something that we call bottoming out, or the breast re-drooping. And one of the things that I've been to a couple of talks here are surgeons who are using internal bras, basically, to try to keep a breast lifted so it doesn't re-sag. What are your thoughts on that?
Well, it kind of makes sense when you think about the breast and how it sags, whether it's before surgery, just natural sagging. The tissue everything is pulled with gravity. You can't get it. I always tell my patients, gravity stops for no one.
Yeah.
So, gravity is going to be pulling on you, and every year you live, it pulls more and more, whether you've had surgery or not. But certainly after surgery, we make changes, we make things perky. Even after a breast lift, in time, that tissue can still sag down. So the idea is you take this piece of material, kind of like a saran wrap, maybe a saran wrap that's woven, and you lay it inside the tissue. Now, it's medical grade, it's sterile, and in many cases it's absorbable and just goes away over time. In some cases it's permanent, but the reason you put it in is sort of to make an internal bra.
Yeah.
And theoretically that would hold the breast up over time. Now the pictures that we've seen in these presentations, they look pretty good.
Yeah, I think the concern that I have with the internal bra idea is that it will hold up the inner breast tissue, but the skin is still outside of that bra, technically, of that inner bra. And is the skin going to continue to sag, whereas maybe the breast tissue stays there? So for me, I'm watching this also a little bit more, a little longer before I start doing it. These devices aren't necessarily FDA approved for that purpose yet.
In many cases.
Is exactly considered in general an off-label use. Now, have you done that with any of your patients yet?
Well, no, like you, I like to wait and see. And I don't like to use anything artificial in the tissue if I can avoid it.
Yeah.
So, using an artificial mesh where I feel like if we do good technique, we'll get a good perky breast. At the end of the day, sagging is natural. And if you make a nice perky breast and you have a little bit of sag over time, after a breast lift, people don't walk around with the breast. I always tell my patients, they're not going to stand up and wave hello to you. They're going to be nice and perky and firm, but then over time, they're going to relax a little bit. And it's natural to have a little fold under the breast. Mm-hmm. Typically after breast lifts, as you see with your patients, they don't sag a lot to the point where you have to do another lift many years later. It usually just looks a little bit more natural, a little of natural hang, I tell my patients.
Yeah.
To me, that's acceptable. And to my patients, they don't seem bothered by it.
I think the other thing that's super important that I've been watching as well, and I did see at one of the lectures on it, was mammography with it. Because the other thing is if you put something in the breast and it interferes with mammography, then that's a huge deal. And the studies that I have seen is that it doesn't when they have used these meshes, although I myself, if I do start doing that, would use an absorbable mesh, not one that's permanent. And so
Right, and so you rely on the scarring formation to hold the breast after it absorbs. But even with the mesh in place, like you, I have some concerns over, gravity.
Yeah.
Again, you can't get away from it.
Yeah.
So it's going to be pulling, and whether the mesh will sag with you or the mesh absorbs and ultimately the breast tissue will sag, yeah, I think that's going to happen regardless of technique.
Yeah, I agree. Well, another thing that's been huge in this meeting that people have been talking a lot about is non-invasive fat reduction. So I've always called that the holy grail of plastic surgery, is how do we get rid of stubborn areas of fat without diet, without exercise, without surgery, without even needles, and it appears that we have accomplished that. What are your thoughts with that, and have you used any of that in your practice?
I have, and I think that there's potential, but you have to look at the results and expectations and kind of match things up, because there is no magic wand that we have that suddenly melts fat and you can just wave it over whatever body part and it'll be exactly the way you want it to be. I mean, the magic wand to me is a liposuction cannula, because at the end of the day, you're always going to get the best results with surgery. So outside of surgery, it is exciting that we have things like cool sculpting, and we have sculpture, and we have Kybella. All these ways. Even radio frequency can be used to melt fat, but the changes are much less than we would expect with surgery.
Yeah, and what I've seen, I mean, right now, if you're watching or you're listening to this and you're saying, wow, non-invasive fat reduction, where do I start? From what I have seen and heard, I mean, really cool sculpting has been something that's been around for many years and probably is the gold standard for non-invasive fat reduction. However, we just got a sculpture device, and I reported on this in my Facebook account recently, and we're really excited to use that. And just like you said, some of the radio frequency devices, there's a new one from Cutera called TrueSculpt. I don't know anything about it, but it's a super exciting time for us.
Yeah, I think there's a lot of potential, and there's no doubt that all of these types of technology will reduce fat. And we've seen it. We've seen it with, I use cool sculpting in the office. You're seeing it, I'm sure, with sculpture. Even with the thermotite treatments that we do with radio frequency, I see some reduction in fat in some cases. So we know we can manipulate it. The real question long term is, how can we manipulate it to maximally reduce fat without having to do any surgery?
So who do you think would be an ideal candidate for, let's say, cool sculpting over liposuction? And how do you make that choice? How do you counsel your patients on which one is best for them?
Great question. Well, I think the first thing is patient desire. When I see someone that wants to reduce fat, the question is, well, are you willing to have surgery, or are you not willing to have surgery? And we've got to talk about the non-surgical options. Now, that's number one, because if the patient doesn't want surgery, it doesn't make a difference what the best procedure is. If it's surgery, they're not going to have it.
Yeah.
So, putting that aside, I think if they're willing to do anything and you're choosing what the best procedure is, well, then it comes down to body shape and the amount of fat that you have. So, if you're thinking about trying to reduce fat and you want to try and limit the amount of invasiveness we're using, small amounts of fat in small concentrated areas, they're perfect for things like sculpture, like cool sculpting, the non-surgical options. But you're only going to get about a 20 to 25% reduction in fat, at least in the case of cool sculpting, in that given area.
Yeah, and I think it's important for people to realize that these fat-reducing devices are not weight loss devices. They're to reduce stubborn areas of fat. So the ideal patient is somebody who eats a reasonably healthy diet. They exercise regularly. They're at a reasonable, healthy weight. And you know what? Mom or dad just gave you those stubborn deposits of fat, whether it's a double chin, whether it's love handles or saddlebags, and no matter what you do, you don't get rid of it.
Yeah, I think the ideal patient for something like this is a patient that comes in, even for liposuction. We should say liposuction is not a weight loss procedure either. You don't lose weight with liposuction. It's just about body shaping. So, the ideal patient for me, whether it's liposuction or cool sculpting or some non-surgical method, the person who's really fit, sometimes a bodybuilder, comes in with that little pooch in the lower tummy that no matter how much they work out, no matter how well they eat, they're not getting rid of that. That's a genetic predisposition to have this little bump of extra fat that they hate.
Yeah.
And so that's an ideal candidate. They're going to do great almost no matter what technique you use.
Yeah. And really, I tell people that the future of plastic surgery of our field, honestly, it's not having surgery as these technologies continue to improve. I mean, when we finished our residencies, and I finished, 15 years ago. How long have you been in practice?
Yeah, just about 15 years.
Yeah, I mean, we didn't have anything like that. There was no non-surgical fat reducers at all. And the thought of, you could actually apply a device and you lose 25% of the thickness of your fat. I mean, that was a pipe dream at the time. So, it's been 15 years since I've been in practice, and approximately that for you. Imagine where we're going to be 15 years from now. It definitely is exciting.
Yeah, there's certainly potential. And every year we're seeing, sculpture wasn't even an option 2 years ago.
Yeah.
So every year that comes by, there's new technology, there's advancements, and the existing technology gets better.
Yeah. Well, the one thing that we do see as well at these meetings is new technology that sometimes doesn't work out so well. We have gone through these devices that doctors buy and the companies will promote as being this great treatment to either tighten skin or reduce fat, make your breasts larger, and a lot of these end up going by the wayside. And sometimes, however, they seem to come back several years later. And one of the things that I've seen kind of come back are these threadless. So when I first started practice back in 2004, threadless started getting popular, and the people who were typically doing that were people who weren't real plastic surgeons. They were internists, ENTs, dermatologists, people who aren't necessarily doing a lot of facelifts and stuff like that, but it's a way for them to kind of get into that market and treat people and try to do a non-surgical facelift. Well, these threadless people found at that time that a lot of these threads were permanent, but the results may last a year. So they fell by the wayside, but now they seem to be having a resurgence. Have you noticed that yourself?
Yeah, I have, and I think that there's always someone trying to put a new spin on yesterday's technology, and whether it's a marketing thing or they're really just trying to refine a technique, it always, it comes around, that pendulum swings.
Yeah. And so that's something that I've been seeing as well, is I think, every kind of generation of plastic surgeons, every 12 years, there's kind of this new crop that seems to come, and maybe they didn't know what happened 12 years before. They start doing that, then eventually it goes away. I even saw that, and I'm not sure the type of breast implants you use, but I primarily use smooth, round implants.
Me too.
And every decade or so, there's a new group of plastic surgeons that are huge fans of these textured anatomic implants. And they think, oh, it makes so much sense. It's shaped like a teardrop, like a breast. Shouldn't that be better?
Yeah, I'm like you. I use the round, smooth implants. I find, and I always tell patients, I like to hold the implant up. You take an implant, when you turn it on its side and you let gravity work on it, they become teardrop shaped because everything drapes naturally in the way that would flow like real tissue.
Yeah.
So if the round implants become teardrop, the teardrop implants, in my experience, the ones that we used to have that were a little bit softer gel, they get really bottom heavy.
Yeah.
So it's not ideal, in my opinion, for cosmetic use. As far as the thread lifts, I think it is. Everything old is new again. Mm-hmm. They put a new spin, but when I look at before and afters of those thread lifts, if you look at a 1 year before and after, I can't tell which is which.
Yeah, and I think that's the thing too, is at these meetings, I'm always looking at how long the after photos are. And sometimes we see these talks and it's like, wow, that's a great result. And you say, oh, it's only been 3 weeks since surgery. And that's too early, obviously. I tell my patients 4 to 6 months for all the swelling to come down after any major surgery. And you can't tell really what you're going to get until after that. It
kind of reminds me of people that you see in social media who do procedures and they show you the immediate after on the table and say, hey, isn't this great? And that's fine. You can kind of see the transformation, but you shouldn't think that that's actually the end result. There's a lot that changes, and when you're laying down, things look different than when you're standing up. So, that duration and getting real before and afters, that's important for assessing any technology. Yeah,
and I want to go over that with you in just a minute. Let's hit one more kind of hot topic here at Vegas Cosmetic Surgery. So, Vegas Cosmetic Surgery used to be called facial plastic surgery, I think, Vegas, and then it went to kind of this multidisciplinary where you have plastic surgeons, dermatologists, facial plastic surgeons, oculoplastic surgeons, and it's this huge meeting here. We're at the Bellagio, great setting, but it's a ton of learning, and this is the only time that I feel I can learn from dermatologists, oculoplastic surgeons, facial plastic surgeons, people that we're really not exposed to otherwise at our normal meetings.
Yeah, it's true. This is a unique situation that we have, and kudos to Dr. Randy Waldman and Dr. Renato Saltz, who get together and brought all of these different specialists together to create this massive meeting where you have dermatologists, facial plastic surgeons, and even practice management things to improve patient experiences, all in one place with so much information. I don't know of any other meeting that has this.
Yeah, and I think one great thing is, we're both board-certified plastic surgeons, but there are a lot of dermatologists here who are doing a lot of injections of filler, of Botox, neurotoxin, and really teaching a lot of things from their perspective that may be a bit different from ours. So there are a lot of new injectable fillers out there. I'd love to hear your take on some of the new ones that are on the market today.
Well, the ones that I'm using more of than the others, and there's many different new products that have come out, but we've been using Refine and Define in the office. It's a Restylane product, and it's a little different. We've been using Restylane Lift and regular Restylane, Restylane Silk. These are the whole palette of their products. Refine and define are supposed to be a little softer, a little more flexible. It's meant so that when you move, you won't notice it. And I like the way it handles. I like the way it distributes in the tissue. It is a little softer. It does seem to cover an area a little more diffusely. And if you ever have a patient that comes, and if you've ever had any injectables in your folds here, your nasolabial folds, and you see a little ridge, sometimes very subtle, but sometimes you'll see that. The define, for example, is what you'd use in that area, and it's malleable to the point and flexible to where when you move and you smile and you move around, you won't see that with these new materials. So again, it's a refinement of yesterday's technology.
Yeah, and I agree with you 100%. I mean, the Wrestling Refine Define, I'm a huge Juvederm fan. So I haven't used a lot of Wrestling in the last several years, ever since Juvederm Voluma and their Ultra Plus has come out. But the new Wrestling Refine Define are completely different. And the way I explain to my patients is, everybody when they have injectable filler, they're worried that they're going to have stiff puppet face. You know what I say, stiff puppet face? You know what I mean by that? Because these fillers, if injected into the skin, can cause the skin to look and feel kind of thick. And sometimes when you move your face, it may not look quite natural.
Well,
you
move
get
a little differently.
A stiff puppet face. Yeah. And so the idea behind these fillers is that they move with your skin, and you actually inject it into areas that move, like the lips, like some of the wrinkles in the lower face. And so we've been really impressed with what they've been able to do with it. And just like you said, I mean, we're just finding more and more indications for this filler.
Yeah, I use everything that's on the market, and I think there's a niche for everything. As you use it, you kind of get experience, and you see how your patients do. There's a role for every filler. So depending upon where we're treating, what we're trying to accomplish, I'll pull things off the shelf I think I need. It's nice to have a larger and larger library of options, because you just get better results.
Yeah. The one thing with Wrestling Refine Define that I'm definitely waiting to see is they do say, now the product has been called Emerville actually in Europe, so it's been used for a long time. Yeah. They say that the longevity is about a year, and that's what I'm waiting to find out, because if the longevity truly is a year, then this is something that we're going to use for a long time. But wait and see. I mean, sometimes these studies you have to take with a grain of salt, and until I actually see it with my own eyes and have my patients tell me, hey, you know what, Dr. Youn, this lasted a year, or this lasted a year and a half, I'm always a little hesitant.
Well, I agree with you completely as far as that goes, and we've both seen new material come out where they say, oh, this lasts 2 years. Then a few months later, well, okay, maybe it lasts actually 18 months. A couple months later, well, no, we expect 12 months.
And if you retreat, if you give them a second dose of 6 months, then it'll last a year. Well,
right, and all the studies that they put out always have this retreatment phase where a little bit more stuff is put in at some interval. So you have to you just need to wait and see, and that's what we were talking about earlier, where I think it's important to not be the first kid on the block to have that new material, that new technology. Wait and see what really proves itself to be worth having.
And one thing, kind of shifting gears now, that I have admired you for is, you're one of the good guys. You have finished your training in plastic surgery, you finished your residency, you took your boards, you passed your boards, you're doing your maintenance certification, you're doing all the things that are needed. You're not taking shortcuts like myself. I didn't take any shortcuts to get to where we're at. You do reconstructive surgery, you take care of people in the ER. I saw on your Snapchat the other day where you were taking a part of a nasolabial flap, I think, on a person who had nasal reconstruction from skin cancer. And these are things that are not necessarily shown a whole lot because it's not sexy, it doesn't make you a ton of money, it's not glamorous. But I really admire that you're out there, you're telling the true story of what real plastic surgery is, but you're also shining a light on the truth about plastic surgery and a lot of people who unfortunately are masquerading as plastic surgeons, and they are treating people, and a lot of their patients may not know that, your quote-unquote plastic surgeon is actually a family doctor who took a weekend course and bought a bunch of advertising. So can you tell us about kind of your journey with some of these things that you're doing on Instagram and Snapchat? Because I do think I'd love to have people check you out for this, because I think it's such great information for them to know about, and it's shocking.
Yeah, sure. Well, thank you for the compliments with it, but I feel a call. I feel it's necessary, and it's not about. People will always say, well, if you're speaking badly or trying to point something out about someone else is doing what you do, it's a competitive thing. I'm not talking about. I practice in Miami, as you know, and I'm not talking about people in Miami. I'm talking about people all over the country, and it's not even me that's talking about it. Patients will contact me and say, hey, what about Dr. Jones or Dr. Smith is he or she really a plastic surgeon? Are they board certified? Because people have a hard time knowing what to look up and where to find that information. So, and I try and become a resource. I think it's important for all of us just to stand up as a specialty and say, look, we want you to have great results no matter where you go. We want you to be safe. And in order for you to do that, you've got to know where to get the information. You've got to be able to get the right answers. So I think each of us individually can do that. And what I've done, and really just out of my sense for patient safety and trying to help people, is establish an account in Instagram called Plastic Surgery Truths. And in that account, we answer lots of questions. It's all video, Q&A videos. People will send me questions. I'll make a video to answer them. We give you guys shout outs. So if you're in Instagram and you'd like to be part of that, you can always send in questions. One of the most important things that we do, though, is when people ask to check doctors out, if they check out, if they're reasonably, properly trained, I'll send a message back saying, hey, Dr. Jones is a board-certified plastic surgeon. Dr. Smith is a facial plastic surgeon that's properly trained. Yeah. You'll be in good hands. Every now and then, someone is, kind of putting themselves out there in a little bit of a disingenuous way. Maybe they're not telling the whole truth. Yeah. Maybe they're outright lying. Yeah. And so what I do is we are producing a series called Exposed. And we've done 2 different episodes of Exposed for 2 different doctors that maybe we're not really telling everyone the whole story.
Mm-hmm. And I think that's so important because, just in my area, of the patients that I see, I have so many patients that will come to see me and they've had a bad result. And, we all have complications, The only surgeon that doesn't get complications is a surgeon that doesn't operate.
That's right.
But it's how these patients are treated before and after. And really, it's the knowledge of what your doctor is. And so some doctors will put that they're board certified on their website, on their social media. Yet the real question is, what are you board certified in?
That's right.
And so there are these ways that they get around really the truth of showing exactly who they are. And yeah, you know what? There are some patients who don't care. They don't care if the person performing liposuction on them is an ER doctor. You know what? If you don't, then God bless you. That's a decision you make. But it's those patients who, after they have a bad result, they go, I didn't know. I wish I would have done more research.
Right. And all too often, it's after the case has been done, whether they have a problem or not, and they look back and say, oh my God, I didn't know that was an emergency room doctor or a family practitioner or, who knows what.
Yeah. So it's been an absolute pleasure having you on. Dr. Adam Rubinstein is a board-certified plastic surgeon in Miami, Florida. He does all types of cosmetic surgery of the face, breast, and body. You also do reconstructive surgery as well. Can you give your information once again to our audience?
Yeah, of course. I would love to have you guys follow me. We're in social media on Snapchat. It's at Dr. Rubinstein, Dr. Rubinstein, Rubinstein. Same thing in Instagram for my personal Instagram page, which is at Dr. Rubinstein. And remember, at Plastic Surgery Truths. And that's a real fun one. You'll see lots of good video. You can send me some questions. I'll answer them and we'll give you a shout out.
I checked that one, Plastic Surgery Truths, out as well. So if you're on Instagram, definitely check out Dr. Rubinstein. Now, I always ask an ending question for everybody at the end of each podcast. One last kind of piece of advice you'd like to give our viewers and our listeners today. Dr. Adam Rubinstein, board-certified plastic surgeon from Miami, Florida. What would that piece of advice be?
Well, we're talking about physicians being trained properly. I think the best advice I can give you is if you're thinking about doing a procedure, it really doesn't matter who you choose, as long as they're properly trained and you have confidence in them. You should have a great trust in your doctor when he or she is going to do this procedure. You like the plan, you like the doctor, you can move forward. But it's important to know everything about that doctor and make sure you're getting a well-informed choice. So do your homework. I mean, that's probably my best piece of advice. Do your homework before surgery. You don't want to be one of those people that has to check it out afterwards. And you can do that through the American Society for Aesthetic Plastic Surgery. There's lots of resources. You can check board certification online at certificationmatters.org. Do your homework and you'll keep yourself safe and you'll be on the road to great results and just be happy in the end.
I think that's great advice. Well, I'm Dr. Anthony Youn, America's holistic plastic surgeon. We are here in Las Vegas at Vegas Cosmetic Surgery. This is the Holistic Plastic Surgery Show. Thank you for watching. We'll see you next week. Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock and have written all the best of these secrets in this book. This includes the Age Fix diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out the Age Fix. Now, if you purchase it on my website, dryoun.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making the Age Fix such a huge success.